Hi everyone, we are here to present findings of our new research report. The title of the report is Social Protection in India's Platform Economy in the Supply Side Dynamics. It was released on 20th March in New Delhi by Professor K.V. Subramanian, Executive Director, International Monetary Fund, and the 17th Economic Advisor to Government of India in 2020-2021. We have the recording of the proceedings of that event on our channel. We are placing the link to those proceedings in the description for your convenience. Without getting further delayed, I'm presenting to you the findings of our report. So the platform economy is a rapidly growing phenomena around the world. Most of us are aware about the large scale creation of the work opportunities created by the platform economy. The statistical numbers on the screen are a good reflection of that. For example, Niti Aayog's estimate that workers in India would be growing from 77 lakhs to 2.35 crores by the end of this decade. In the same decade, as per the ILO, the number of platforms worldwide grown from 142 to 777. Now, coming to the definition of social security, the screen shows the definition as per the Code on Social Security. I would like to call out of some of the social protection measures that the definition is pointing to. These are healthcare, income security, old age, unemployment, sickness, work injury, and maternity. Code on Social Security 2020 makes the provision of social protection for all kinds of worker, irrespective of the employer-employee relationship. This way, Code on Social Security breaks the traditional approach to social protection that was structured around the standard employment that includes social protection benefits for a formal worker, such as provident fund, pension funds, and health cover, etc. Platform work is different. It provides flexibility to workers and it has a transient nature. Thus, we see workers working across different platforms at the same time, and there is no employer employee relationship. Platform economy probably needs a tailored approach, portable social protection benefits with continuity of such benefits. With that as a background, uh, we started our study with two objectives. One, to fill knowledge gap in the information available on the social protection benefits that platform economy offers to its workers today, and the share of policy learnings of the social protection from the world. To meet our objective, we reached out to 10 platform businesses across four different sectors of operation. These platform businesses together have a total of 56,400 crores and engage with estimated 45 plus lakhs workers around the country. In addition, we reached out to two workforce providers. These workforce providers provide the stream of workers to the platforms during the uh, high demand times. And in addition, we reached out to one government institution and that provides social protection in India, and another government institution that provides training to workers at the pan-India level. Both of them are housed under the Ministry of Labor and Employment. And further, VNLI had a comparative analysis from the developed and developing countries around the world. Quickly moving to our findings. The table provides a summary of our findings that is from four different kinds of platforms, as you can see. So we see accidental cover and some kind of health and medical support as the common benefit across different platforms. With say, for example, if accidental benefit varies from 5 lakh rupees to 10 lakh rupees in different sectors. And similarly, we see a great variation in health and medical support, to which I'll come later. Um, and you can see that the old age protection is completely missing out across different uh, uh, sectors. And we see education support for children as an example of an unconventional social protection benefit that is being provided in the sector. Now, in addition, the table provides upskilling is the common measure, access to credit, and you can see maternity leaves and affirmative action for the promotion of more engaging more women workers in the sector from hyperlocal delivery in particular. I'll come to these details further in the slide. Now, as I have mentioned, the common benefits are accidental insurance with covering disability and death, medical benefits of several kinds. Now, when it comes to medical benefits, we see some variation in terms of telemedicine kind of services provided by some sectors. In addition, discounted medicines and diagnostic tests, and a few platform businesses are also providing health insurance with or without top-ups for covering the family members. Now, we have some interesting variations to encourage women participation through joining bonus, paid maternity leave, policy to protect women against sexual harassment getting extended to the platform workers, and lastly, the access to credit. Now, there are a few developing areas that we see from our findings that old age pension is consistently missing in the sector. That is largely because of the transient nature. And financing of the health cover is a challenge, as we know that the uh, inflation uh, in the healthcare sector, particularly after the COVID, is in the double digits for last 4 5 years, and that has increased the cost of uh, the comprehensive health cover. Thus, that is why we see that amount of variation all across the sectors, probably because of the differences in the margins that these businesses are creating from the platform workers. Um, and lastly, there are other issues such as the awareness and access related challenges and the variations across the sector. Now, coming to the end, I would like to invite Jagriti to take forward our presentation on the results. Jagriti.
Thank you, Prakash. So, as Prakash concluded, there exist several provisions across different categories of social protection measures on the supply side, but there is room for improvement in other areas such as old age benefits and maternity benefits. Perhaps we could learn a thing or two from global case examples. The global landscape of social protection is characterized by one, dismantling the formal informal dichotomy, by which I mean extending the available benefits of informal workers to platform workers and entrepreneurship promotion. One example of dismantling the formal informal dichotomy is the concept of social protection floors. These systems aim to provide a basic level of protection for all residents, irrespective of their employment status or their relationship with an employer. The social protection floors, such as monotax system in Uruguay and universal credit in the UK, paved the way for progressive universalism as highlighted in the sources. This is a concept that aims to reduce health and educational inequalities by providing social protection and quality education to all individuals, especially in the most disadvantaged and marginalized groups. India's cause is another way of achieving the same objective. It does so by recognizing and defining gig and platform work and e-Shram portal to supplement the act so that the disbursement of benefits can be taken up. Now, with this in mind, we conducted a comparative analysis of social protection schemes in one, Uruguay, Indonesia, India, the UK, and the US. I'd like to highlight an important point using the features of two schemes. One, Uruguay's monotax system, which simplifies tax regime for self-employed workers with low income, granting them access to social security benefits. In France and Portugal, PAIR and ACPE allow people to take breaks from work to pursue their entrepreneurial ventures. Two, the BPJS scheme in Indonesia consists of BPJS Kesehatan providing healthcare coverage, including working accident compensation, and BPJS Ketan Gakarjan offering social security benefits such as accident compensation and old age protection for workers. Now, what makes these schemes viable? While monotax is being paid for by the government, The BPJS scheme is paid for by the workers themselves. We wondered if who pays for the scheme has any bearing on the provision of the scheme themselves. With this in mind, we have looked at four kinds of benefits, including old age benefits, health and medical insurance, disability benefits, and maternity benefits. Example of old age benefits includes BPJS scheme in Indonesia and the monotax scheme in Uruguay. Example of health and medical insurance includes BPJS scheme in Indonesia and France, and Germany classifying platform workers as self-employed. In addition to health benefits, this classification also facilitates extensions of disability benefits. In the UK and Uruguay, maternity benefits are extended to workers that are classified as self-employed. BPJS scheme is worker funded, while monotax scheme is government funded. Now, with that crash course on global landscape of social security, we'd like to share some recommendations that have emerged from our study. For industry, civil society, and government alike, we urge enhanced awareness and innovative approaches to social protection. While the awareness can be achieved through educational campaigns, accessible information, and tailored communication, innovative strategies, nurturing innovative approaches to social protection entails exploring new methods and technologies to expand coverage and improve relevance of social protection for platform workers. This may involve developing digital solutions, flexible schemes, and collaborative initiatives that cater to the unique needs of working conditions of individuals in platform economy. Specifically, we call on the government to establish a central coordinating authority. This centralized body could facilitate better communication, collaboration, and implementation of social protection policies and programs. Two, harness existing infrastructure to optimize the resources and capabilities already in place to improve the effectiveness and coverage of social protection measures. Three, making social protection benefits portable across all states of India would enable individuals to access and retain their entitlements regardless of their location or mobility within the country. Four, and adopt the guiding principles of the RACE framework. What is the RACE framework, you might ask? RACE framework has been conceptualized by OMI Foundation and has been adapted by global bodies like BRICS. In RACE, R stands for recognizing the varied nature of platform work. A stands for allowing innovative financing mechanisms to augment social security. I stands for institutionalizing a scientific approach to scheme designs. S stands for supporting worker participation in government schemes. And E stands for ensuring benefits are accessible to all workers. With this, we are coming to the end of our presentation, but this is not the end. This is just the beginning of unpacking a complex but urgent problem. We see the following roadmap for future research. One, a demand side study and the impact of platformization on India's GDP. We are committed to following this roadmap and would invite other people for collaboration. In closing, the journey towards equitable social protection in the platform economy is just the beginning. But with collaborative effort and innovative thinking, we can forge a path that safeguards the well being of all workers, ensuring a more inclusive and resilient future. Thank you. I thank all of you on behalf of OMI Foundation.
Thank you.